ado, I'm going to hand it over to Natalie.
Yeah, well, thank you again for having me. Just to kind of re-emphasize a little bit of who I am, I thought I'd start with a couple of pictures. So I mentioned I like to be out in the foothills, singing behind a microphone with I sing in a worship band locally, and then I enjoy being outside. So just a little bit of insider peek into my life and my cute little doodle dogs over there. You might even get to see, sorry, I turned my camera off. You might even get to see at some point during this webinar my cat, who might feel the need to join. So today we're going to be talking about the dangers of senior loneliness and isolation, and just kind of given our current COVID-19 pandemic isolation status, it's of more importance now than ever. The details, limiting times of social isolation are not in conjunction with this sickness, but I think now as a whole we can all kind of maybe have a little more empathy and understanding of what it's like to be isolated and alone, unable to leave our homes, or it's not advised to leave our homes. So in the webinar today, we're going to talk a little bit about senior loneliness, isolation, signs that may indicate a need for help, some other healthcare issues that may be caused by loneliness and isolation, some ways to combat loneliness, and then what my office, the Southwest Idaho Area Agency on Aging, and others throughout the state are doing to help seniors. So when you look at this infographic on this slide, lonely seniors have a 59% higher risk of physical and mental decline. Loneliness can be as dangerous as smoking 15 cigarettes a day, which I thought that fact alone was quite interesting. We all associate smoking with quite a few illnesses and diseases. And so when we think about just being home alone and not having any social interactions, it's very equivalent. The rate of depression for seniors who live in residential care facilities has been as high as 44%. I want to make a note that this infographic is some Canadian statistics, but fairly similar, mimicking throughout the senior population. Seniors who suffer from loneliness have a 64% higher risk of dementia, which is a huge factor in looking at why this is important. And in 2009, so this is a little bit dated, 1 in 4 seniors aged 85 plus felt lonely at least some of the time. That's a big chunk of people. There are a couple of factors that increase the risk of isolation. Just being 80 plus, having some other chronic health problems, living away from family, having less contact with family, living in a low income status. Some, in Idaho, it's not just low income, it's language barriers, and then family structures are changing. So we're going to talk a little bit about quite a few of these things today. So in 2013, the World Health Organization, the WHO, found that approximately 15% of adults over the age of 60 suffer from some type of mental disorder. And many confuse the symptoms of mental illness with just signs of normal aging. So in Idaho, which is a great place to retire, we have quite the growing aging population, which is good on some hands, and also, what are we doing to be proactive in combating those healthcare issues, such as, senior loneliness and isolation. And that's, when seniors are home for an extended period of time. Us as humans, we have this fundamental need to socialize and be included and to be part of some type of community. I think we're all finding that as we are more and more stuck at home. We're like, how do we get out? Who do we talk to? How do we connect to people? Loneliness is a significant health factor, and we're going to kind of look at some of the reasons why. So when we pull up these American Health Rankings for Idaho, we can look at the risk of social isolation measures. And in essence, when we look at these, there's a couple of measures that we look at. So our seniors that are over age 65, that's kind of the categorization here. You know, is there a disability? Are they divorced or widowed? Are they homebound? Do they live alone? You know, all of these things increase the risk of being isolated. Idaho, as you can see in the geographical map, we're at a lower side of the risk of social isolation. But we still have to be aware of the factors that influence our seniors. So I'm not going to play this video, just kind of in an effort to save some time, and hopefully it doesn't start auto playing, because that would be a great thing of technology to do to me today. This video really talks about the loneliness epidemic. So, you know, currently we're in a virus pandemic, but the loneliness epidemic is, you know, looking at what it's like to be home alone, to not have family nearby. And it might, if you are somebody caring for seniors or a senior yourself, might put a name to those feelings that we have about being alone. So I highly recommend watching this. It's not a very long video. I want to say maybe 10 to 15 minutes. But something that you'll have access to these slides later, something that I would highly recommend watching, just as kind of an informative, an additional resource. So kind of going back and backstepping a little bit, what is loneliness? So loneliness is that feeling of lacking meaningful social relationships. So when our seniors are saying they wish that they had more friends, they don't see enough friends or relatives. There's nobody to confide in. There's no real friends that are living nearby, and they don't meet enough people. So all of these things can add to feeling lonely. I'd also like to point out that being lonely, you can be lonely in a group of people, right? You can be lonely when you're living with your spouse. That need and feeling of those more meaningful social relationships, that doesn't go away. Now, social isolation, and how many times I might fumble on that because it's a little bit of a tongue twister. Social isolation is the absence of those meaningful social relationships. So these are people that do live alone typically. They don't go out of the house. There are no close relatives. They never visit anyone. They have no contact with any neighbors. They're alone for a majority of the day. Some of them do not have any telephones. And that nearest neighbor is more than 50 yards away. So in Idaho, that's, you know, very probable in some of those rural communities where they're living on farms, ranches, and the nearest neighbor, you know, if they needed help, nobody would hear them. When we look at isolation, you know, I've got to reorganize my notes. You know, seniors that face isolation are more likely to suffer from elder abuse. You know, it does also include couples. I know one of the key points is that they live alone, but sometimes couples are isolated together. Social isolation can be seasonal. In the winter, a lot of seniors don't get out because it's hard and it's a little dangerous. There's that fear of maybe falling in the ice or the snow. If anybody remembers a couple of years ago during the Snowmageddon, you know, crazy snowfall, that a lot of people were stuck inside, which, you know, I myself included, and I really gained some insight into what it was like to be home alone, and to be very isolated and not able to help myself. I needed to have somebody come get me because my car was not able to get through the snow. Isolation is also an objective measure of the number of contacts people have. It's not about the quantity. It's about the quantity, not the quality of relationships. So when you can measure the number of people you have in contact with, unlike being lonely, those are more feelings and it's a more subjective kind of way to look at, are you home alone, or are you do you have some meaningful relationships? So there are a couple of warning signs of senior isolation. One is you're noticing that your seniors has an unhealthy diet. They're not really taking care of themselves physically. They're not eating well, not able to, and maybe that's because they're not able to go to the grocery store and shop for themselves, or they're not able to cook for themselves properly. Some sources have said that there's some sleeping problems, which sleeping issues for seniors can be common. A lot of seniors are up a number of times throughout the night, using the restroom, etc. But it's more they're just having more episodes that they're not able to get quality sleep. And then some other signs is that there's that reluctance to participate. No, I don't want to go to the senior center. No, I don't want to go out to church or to a meal, because of a lot of underlying issues, but kind of that withdrawing from normal social activities. Those are really key signs that something might be up, and it might be worth checking into. Let's I'm going to go back just a second. Loneliness, in addition to isolation, really can also act as a fertilizer for other diseases. So Dr. Cole from UCLA says, the biology of loneliness can accelerate the buildup of plaque in arteries, help cancer cells grow and spread, and promote inflammation in the brain, leading to Alzheimer's disease. Loneliness promotes several different types of wear and tear on the body. So those feelings of being lonely in conjunction with the subjective factors of being isolated can really cause a whole host of other issues. The misery and suffering caused by chronic loneliness and isolation are very real and warrant attention. As a social species, we are accountable to help our lonely children, parents, neighbors, and even strangers in the same way we would treat ourselves. Treating loneliness is a collective responsibility. So there's been a lot of recent research to treat loneliness as an actual mental health issue, instead of just saying, oh, it's too bad you're lonely, go make a friend, but to help them and to give people tools to combat being lonely. So some of the other health risks that are associated with loneliness and isolation: depression, high blood pressure, heart disease, obesity, a weakened immune system, anxiety, cognitive decline, and at times, being lonely and isolated can even lead to death, which is sad. So we can look, at some of these issues, prior to working with seniors and elderly. I probably would not have associated being lonely and isolated with an increased risk for high blood pressure or heart disease. But when we look at some of those risk factors we looked at earlier on the slides, unhealthy eating. So if you're not eating well, and maybe there's more frozen meals that have a lot of sodium in them, or maybe not very heart healthy, your blood pressure is going to increase. There's an increase of heart disease because they might have a lot of fat in those meals, which then leads to obesity, which can cause a whole host of other things. Isolation-induced depression appears because of lack of a lack of social interaction. In other words, if the elder person doesn't have a strong support network or spends a large amount of time alone, isolation and subsequently depression can sometimes set in. And this is an article from the National Alliance on Mental Illness. Some studies have found that perceived isolation, or just the feeling of being isolated, even if you aren't, can also have negative effects. In fact, Psychology Today notes that social isolation can occur by choice, like when the person makes the conscious decision not to be around others, like many of us right now are in that decision to be isolated at home to prevent the spread of the coronavirus. But this type of intentional isolation is oftentimes temporary. But when that becomes the new normal, and you're not willing to go out, or you've become more of a permanent shut-in, that is when these risk factors and these other health risks can become more of an issue. And I realized I didn't ever stop and say, and I know Anna did a little bit at the beginning, but if you do have questions, I see the chat box too, and I will try to answer. And I'm sorry if there's some sound issues. Technology only sometimes works so well, right? And I'm hoping that the garbage man in my neighborhood, since I am working from home, think he's done. So hopefully that won't be an issue in the sound as well. Great. Awesome. Another article that was published for the Journal of Clinical and Diagnostic Research shares that one, and we've already discussed this too, but social isolation leads to loneliness, which can then lead to some other psychiatric disorders, depression being one, but loneliness can also increase risk of personality disorders in addition to Alzheimer's disease. So that cognitive decline, when you don't have the same social interactions that you used to in your home, watching some program on TV and you're not able to discuss that with anybody, or to just have any discussion, you are really at a risk of becoming more and more isolated. But not exercising your brain increases your risk of some type of cognitive decline and dementia, in addition to just, dementia's risk factor goes up with age. So definitely something to keep in mind. Isolation is preventable. It's hard when we're older, we don't have as much transportation, being widowed and losing our ability to transport ourselves places, so our ability to drive. It's definitely a challenge, and I'm not diminishing that fact at all. But make social engagements a priority now. So if you can, engage in some social groups. Obviously, right now, we're at a totally different time than when we had started planning this this webinar. We're in a time where engaging in social groups out in the world of is not possible. But when it is available again, and it will be, give the virus some time to run its course, and hopefully we'll slow the spread down. But once those social groups are available, senior centers, church groups, exercise classes, community learning opportunities, volunteer opportunities, all are great ways to meet new friends and to engage socially so that you're not as isolated. That being said, sometimes it takes a lot to get out of the house. There are quite a few resources, and we'll talk about that in a later slide, to help seniors with some transportation. The senior centers do have transportation available to get to the congregate meals. A lot of them throughout the state can prepare and can help in those ways. I think I'm about to have the doorbell ring. There it is. We also, at the senior centers, there are senior exercise classes like Fit and Fall Proof, which help which help prevent the whole goal is so that you're more stable on your feet. A lot of times seniors aren't willing to go out because they're afraid of falling, and that's a legitimate fear. If you need to use an assistive device, then please do. You know, I know there's a lot of a lot of hesitation in using them because then it's this social stigma of needing help. But if that is a device that's going to help you get out into the community and be out, then please, I would highly encourage you to use those. There also are a lot of online chat groups, which I've had to do some research on for not only, you know, this webinar, but just for my office, for ministry groups. There was one online meetup type group called Stitch. I think it was developed in Australia. I don't know if they have a chapter here in Boise yet or in Idaho, but it basically connects seniors or those 55 plus to other seniors to go and do random things. So one of the examples they used was a lady was waiting, dropped off her grandkids at a sports practice and had about a 2-hour window and wanted to go shopping at the thrift store. Nobody wanted to go with her, so she posted it on this online group that, hey, I want to go to this thrift store. It's in Chandler, Arizona. I'm going to be here from this time to this time. And people are able to see that as a resource, as an event, and can join her. And so then she made a couple of new friends, and they all now go thrifting together, which if that's something that interests you, then that might be a good resource. And I'll post all of the resources in a separate page after the webinar. AARP, if you're a member, they also have some online chat groups that might be a helpful resource for you. And then Meetup is another online kind of posting events and going to meet people. At this point, just kind of given that everybody's hunkering down and staying in, looking for the Facebook groups, looking for some of those online live stream, you know, kind of watch movies with friends, but use FaceTime or use a Zoom meeting, use, you know, Google Hangouts. It's a lot of technology based, but it is a way to connect with people and to kind of go back through and not have as many lonely days. So we might all be stuck at home for over 9 hours a day. I know, you know, I myself am in that same boat, but we have some, you know, great technology to use in this time, which, you know, thank goodness we often can be like, oh, technology, you know, it disconnects people, but at this point, it can really help connect people. Even I saw Netflix is doing a watch movies with friends kind of add-on. So if you know, are able or have some grandkids or some kids that are able to help you set those up, gosh, I haven't even set up the Netflix with friends thing yet, so I'm not sure how it would work, but I think it's a cool way to watch a movie, but, you know, be in community without being physically together. So I work for the Area Agency on Aging, and our office is really geared to help anybody 60 and over with connecting with any service that they might need. So congregate meals that happen at senior centers, home delivered meals, you know, that we contract out and take to people that are homebound and isolated. We help with homemaker service, transportation service. The workshops that I teach, they're health promotion and wellness workshops. So it's a way for community to come together and work over, you know, 6 weeks time of promoting wellness and learning about ways to live well with diabetes or chronic pain. But also it's really a social interaction. Every week you form a community and then form some support. We provide respite services. As Anna mentioned, I came from the ombudsman program, so I've been a resident advocate, and I've done a lot of work in helping residents resolve some issues at their care facilities. And then our office, we also do adult protection, as well as the kinship care program, which is grandparents caring for grandchildren. Gosh, a whole host of programs. Probably the most important program for this specific topic are the congregate meals and the services that are delivered at each senior center, and then the home delivered meals, because they offer, one, if you're going to a congregate meal, it's a meal at a senior center, usually a lunch, and given which area you're in, it could be every day, could be every, once or twice a week. Some senior centers do a breakfast on the weekends, or some do a just a dinner once or twice a week. But depending on your area, it's a great way to come and form some community, to make new friends, and to really let people know that you're here, you're in that community, and kind of getting that word out. So that if you do need help, if you don't have neighbors close by, people will know where you're at. I mentioned earlier some transportation services. A lot of our senior centers have a senior bus, and they're able to, if you're not driving anymore but are not homebound, and you'd like to go to the senior center for a meal, a ride could be arranged for you for the most part. So that's another option to think about. If you live in the Meridian area, there's like a 5-mile radius around, but Harvest Transit is another great resource to use for seniors that are not driving. Just another way. We live in the land of Uber and Lyft and taxis. Those can get really expensive, and a lot of times we try to save up those times that we really need to use those services for more important things like a doctor's visit, but they're still available. And then we live in this great time that grocery delivery is available, although at this moment I've heard if you're ordering groceries for delivery, it's maybe 4 to 7 days out. So, kind of plan ahead on that. But there's a lot of ways to help make being at home safe. And then if you're not able to be at home, the ombudsman program, adult protection, if there's somebody that's being abused or exploited, you can always call those in. These things happen here in our area, and in the Southwest Idaho area. We cover, just kind of picture the map in your head. So we have Boise out to Payette and Fruitland, up to Cambridge, Council, McCall, and all the way over to Glens Ferry, Mountain Home. But there are area agencies on aging throughout the entire state of Idaho. And so if you need service, all you'd have to do is go to the aging.idaho.gov website and click on that area, and they'll connect you to the proper area and to get the resources that you need in your area. I've also included a couple of other videos of just because I think in this kind of technology time, I think the videos are great resources for what we're looking at as far as loneliness and isolation, how being elderly increases that chance of being stuck at home, because maybe you were widowed and your spouse was the only one who drove. That was the case for my great-grandparents. My great-grandmother never drove a day in her life because my great-grandfather did all of that for her. So when he was unable to drive, she didn't go anywhere and they were stuck at home. I look at the same issues with my grandmother now, and she lives far away, and luckily, I have family that are able to help her in the town where she lives in Houston. But otherwise, she's stuck at home now. She's not doing well, and I'm constantly sending her ways to be more engaged, to communicate. And luckily she does have a great church community, but some of our seniors aren't as lucky. I'm going to pause and see if there's any questions. But I don't, let's see.
It looks
Sorry.
like it looks like we haven't received any yet, but we'll see a few rolling. Here we go. From Christy Ramirez.
So from Katrina, many seniors are used to being strong, relied family community members who provide valuable support, such as providing childcare or other family community support. Now that this COVID-19 has taken that away, feelings of uselessness within the family structure is likely to be heightened. Can I speak to that on how seniors can continue to feel relevant and useful? Yeah, that is hard. I think I don't think that that's an isolated problem to just our seniors at this point. I think we all, the ones who are working from home or, kind of stuck in this limbo, we're at this weird time in history. What I've seen work really well is, do keep your seniors as isolated as possible to decrease their risk of getting sick from this virus, from COVID-19 or coronavirus, because they have a higher incidence of being really sick and getting hospitalized. In the meantime, if they have the capability, FaceTime is a great tool. I've seen a lot of resources of reading stories out loud to either their grandchildren or to, I've seen teachers read to their students and post a video so that there's still that type of connection. One thing that I saw that I felt was most relevant is telling our seniors, please stay home. You're not being it's not that you're being useless and you're not being used. I want to see you in the future. And so I'm protecting you now. And for this short period of time, relatively, we want to protect you so that I can see you in the future, so that we can continue to be, useful. If your family member is able, there are quite a few local organizations that are in need of some supplies. And so if they're able to leave them on a doorstep for pickup, making some type of, I think Corpus Christi House was looking for breakfast items like muffins and things. And so they might be willing to do a pickup. That could be a great resource as well. Unfortunately, there really isn't an easy answer, I think, for anybody on, being forced to be isolated and stuck. I think will cause a lot of distress amongst the entire population. Are there volunteers in Boise that visit elderly at their home? So yes, there are, through hospice agencies, through home care agencies, there are people that do go and visit. Obviously hospice is a completely different subject on, how that works. Our office, we do phone intake. So if you needed some type of service in your home and you're not on Medicaid, so the government assistance, we will do a short intake over the phone, and this goes for all of the agencies on aging throughout the state. A short intake, kind of asking, are you homebound? Do you have any supports in the home? So is there somebody helping you that lives with you? Are you able to cook a meal for yourself, and kind of some basic questions. And then it's determined whether or not, you qualify for a home delivered meal if you needed help with your homemaking type thing. So the homemaker service, it's limited in hours, but it's a visit at least twice a month. Same with the meal, the lunchtime meal. That's at least a face-to-face interaction. In some spots of our state, it's maybe once a week. They get a warm meal and then 6 frozen meals, but it's eye contact once a week. You know, there, with the hospice and home health agencies, there are some that just go and visit to just have company. There are a couple, I mean, churches will also kind of fill that gap as well. Our agency doesn't have necessarily a volunteer group to just go visit people in their homes. I do know during this time with COVID-19, we're kind of adapting as each day comes and changing. Our office will be calling the seniors that are homebound and making sure they're okay and giving them a phone call in an effort to kind of continue that social interaction for them. Ooh. It's a good question from Anna. How can we communicate to seniors in our family about the importance of social distancing? I have a family member who doesn't seem to understand the concept, and I'm worried she'll put herself and others at risk. That's a great question. So the best video I found was the Mel Brooks grandson, where, you know, he's the grandson saying like, I'm 47, I'm choosing to not visit my grandfather who's in his 90s, and I'm choosing not to visit him because if I get my grandfather sick, I'm getting the entire, you know, the entire comedian gang from that era, I'm going to potentially wipe them all out. I think really stressing the importance of this virus is different. You know, working with healthcare professionals, reading the recommendations from the CDC, talking to my own family who are physicians. The virus lives on hard surfaces a lot longer than most viruses, like the flu. The flu, I think, lives maximum of 12 to 24 hours on a hard surface. COVID-19 and coronavirus, this one's living a lot longer. And so the incidence of being sick without knowing it happens a lot faster. So really stressing this importance of, gosh, I don't want you to get sick, because if you get sick as a senior, pneumonia, respiratory illness, there's only so many resources in our nation. You know, looking at other countries and how they've handled this. Eventually, if our hospital systems become overrun, they're going to look at the ethics committee and start triaging people, and that's something we don't want to ever have happen to our loved ones. And so, yeah, we have to stay home. It's a bummer. We're isolated. We're watching more Netflix and, you know, or cable TV than we ever have before. It doesn't mean that we can't go outside and go on a walk or, you know, talk to our friends or FaceTime, but it is hard. But, you know, something to really emphasize, or, you know, you can always have them talk to me too. I'm more than happy to explain why, because I think it's hard to say, I don't want to give these things up. I've experienced that with, you know, my grandmother who doesn't want to not go to church, and I've had to tell her, but if you do go and somebody's sick, you might become sick and get really sick, and we don't want that at all. So at this point, you have to stay home. I have to stay home to protect everyone. It looks like Christy says she's a service coordinator at a low-income elderly property. You can think of a woman that would love to go shopping. Super sweet. Oh, that'd be really fun. You know, having some of those people in those communities, you know, work together to set up times to maybe go shopping, or to go and do some, you know, group activities. Again, once the virus and our quarantine and social distancing time has passed, which I'm hopeful that it will. I don't know how soon that will be, but I know that it will at some point pass. Are there any other questions? I think to kind of go back and circle back, feeling lonely seriously impacts physical and mental health, and the key is to stay in communication. I think during this time of being socially distant physically, it means that we need to be in more communication, verbally, via FaceTime, making phone calls, sending text messages. It's a time to really go back and focus on those communication skills and talking with people and checking in on our grandparents or aunts and uncles who might be older, or maybe a new mom who has an infant at home and is not wanting to take their newborn out to go grocery shopping because who knows the zoo that they might find at the Costco. One of the things that I read was that some healthcare plans are even looking at saying that loneliness is a chronic illness or condition to help provide other treatment options. So what that would look like is, maybe having them, helping them with access to counseling, to social work, to other resources that can help with their loneliness. Something that the Journal of American Medical Association found that 43% of older adults reported feeling lonely. And then again, that loneliness is associated with a high risk of mortality. And a lot of our seniors, they are living alone. And so they're alone. They might be lonely. They might feel isolated, just kind of given their circumstances. Again, this time is a little different given our virus, our virus status. Let's see. I think that's honestly kind of all that I really had. I'm a little discombobulated as I had to switch from being in my office to at home. So my notes are a little more scattered than I would have preferred. But were there any other questions? We might end a few minutes early. I'm sorry, Anna.
Oh no, that is totally okay. And I mean, we in Empower Idaho are also kind of discombobulated, like I'm working right now, so it's totally fine. But if anyone has any more questions, we can hang on for a little bit longer. Like I said, this great webinar will be on our Facebook page and on our website, which I put the link in there under consumer education. So we'll hang out for a little bit, take any questions, and like Natalie said, you can always reach out to her. She's more than happy to answer questions, it sounds like. So, and we are
is right there.
Great. I'll actually share your.
I think the important thing is, and I think this time with COVID-19 is really showing us, is that communication is important. Reach out to those people that we're not talking to. There are a lot of resources, to not be as lonely and isolated, but it takes some communication. It takes, especially if you are, if you are a senior and you're struggling, to say that you would like some company, and that's hard. It's hard to say that you need help. It's hard to kind of step out of that comfort zone, to step out of the box. It's not an easy thing to do. It's not something that will happen overnight, but do reach out. Our office is more than willing to help you in any way we can, to connect you to resources. Look at some of those online chat groups that are popping up, especially more now in this social isolation bubble we're living in. But I think being proactive now can help really decrease these feelings of loneliness and isolation and increase our overall well-being and health. I'm going to type in the chat box to our the office. So the number that's posted is my direct line at my office, and I'm going to type in our main office line. So so if you do, need some services or need to connect to Meals on Wheels, that you're able to do that.
Awesome. So next week, same time, next Wednesday, so I think that's 25th, we'll be having Natalie join us again for a similar topic training, but kind of geared towards providers of behavioral health services. Anyone can join. So please, if you would like to join or you need a little bit of interaction, please pop on. We'd love to have you. We have that is also an event on our Facebook. I can quickly put the link to that if you're interested in registering in the chat box as well. But unless Natalie has a question that was sent directly to you, I can't see any other ones in the chat box. So yeah, so I guess we can kind of log off for the day. I just sent that link along for next week's webinar if you feel so inclined to join us again. But Natalie, thank you so much for being here today and talking about this important topic that's so relevant right now, and also for, even though your schedule has been completely shaken up, for still being able to come through for us. So thank you.
Yes, you're very welcome. Have a great day.
Okay,
Thank you
bye.
for having me.
Of course, we'll have you again. Bye.